Have you ever walked into a room and forgotten why you're there? Or misplaced your keys, only to find them in the fridge? Shockingly, studies show that up to 40% of seniors experience memory lapses linked to medications they take daily. In this video, we'll uncover 13 common drugs, prescribed to millions, that could be silently robbing you of your memories, focus, and independence. From anxiety pills to heart medications, the risks are real. Stick with us to learn how to protect your mind. If this resonates, hit that like button, share with loved ones, and subscribe to Ageless Living for more life-changing health insights. Let's dive in. Medications and your brain. Imagine this. You're sitting at the dinner table, surrounded by family, but you can't recall the conversation you had with them last night. Or picture yourself frantically searching for your glasses, only to realize they're on your head. These moments might feel like quirks of aging, but what if they're not? What if the little pill you take every morning is quietly eroding your memory, clouding your focus, and increasing your risk of dementia? This isn't about illegal drugs or experimental treatments. We're talking about medications sitting in medicine cabinets across America. Pills prescribed by trusted doctors, taken by millions, and even available over the counter. These drugs, meant to help, could be doing the opposite, especially for seniors. In this in-depth exploration, we'll reveal the 13 medications that could be harming your brain, backed by science, real-life stories, and actionable steps to protect your mental clarity. Why does this matter? Because your memories, your independence, and your ability to live life on your terms are at stake. Let's break down each drug, how it affects your brain, and what you can do about it. 1. General anesthetics, the surgical necessity that could change your mind forever. When you think of surgery, you likely focus on the procedure itself, fixing a hip, replacing a knee, or saving a life. But what about the anesthesia that makes it painless? General anesthetics are essential for modern medicine, but for seniors, they can come with a hidden cost. Up to 40% of older adults experience postoperative cognitive dysfunction, POCD, a condition that can cause memory loss, confusion, and personality changes that last months or even become permanent. How it harms your brain. General anesthetics work by flooding your brain with chemicals that suppress consciousness. This process triggers neuroinflammation, disrupts neurotransmitter balance, and can even kill brain cells. The hippocampus, your brain's memory center, is particularly vulnerable. For older adults, whose brains are already less resilient, this chemical assault can be devastating. Studies, like those published in Anesthesiology, 2019, show that POCD can make patients feel like they've aged years in just hours. Real-life impact. Take Ruth, a vibrant 74-year-old who managed her finances and drove confidently before a routine hip surgery. Post-operation, she struggled to remember familiar routes, couldn't balance her checkbook, and needed daily help. Her surgery was a success, but the anesthesia stole her independence. Her story isn't unique. Millions face similar outcomes without warning. What you can do. Ask about alternatives. Discuss regional anesthesia, like epidurals, with your surgeon, which may pose less risk to cognition. Monitor recovery. If you or a loved one undergo surgery, track cognitive changes post-procedure and report them to your doctor immediately. Support brain health, pre- and post-surgery. Boost your brain with a nutrient-rich diet, exercise, and cognitive activities like puzzles. 2. Metformin, the diabetes drug starving your brain. Metformin is a cornerstone of type 2 diabetes treatment, praised for its ability to control blood sugar. Over 120 million people worldwide take it, but long-term use hides a dangerous side effect: vitamin B12 deficiency, which can mimic and accelerate dementia. How it harms your brain. Metformin blocks B12 absorption in the gut. Since B12 is stored in the liver for years, deficiencies develop slowly, often going unnoticed until symptoms like memory loss, confusion, and personality changes emerge. B12 is critical for myelin, the protective sheath around nerve fibers. Without it, nerve signals slow, and brain function deteriorates. A 2020 study in diabetes care found that 30% of long-term metformin users develop B12 deficiency, increasing dementia risk. Real-life impact. George, 71, managed his diabetes with metformin for 8 years. Gradually, he became forgetful, irritable, and paranoid, symptoms his wife mistook for Alzheimer's. Blood tests revealed a severe B12 deficiency. Injections helped, but some cognitive damage was permanent. His story highlights a preventable tragedy. What you can do. Test annually. Ask your doctor for yearly B12 blood tests if you take metformin. Supplement wisely. B12 injections or high-dose oral supplements can prevent deficiency without compromising diabetes control. Monitor symptoms. Watch for signs like fatigue, memory lapses, or mood changes, and address them early. 3. Interferons. Immune modulators clouding your mind. Interferons treat serious conditions like hepatitis C and autoimmune diseases, but they can wreak havoc on your brain by triggering neuroinflammation. This inflammation damages neurons and disrupts neurotransmitter production, leading to chemobrain, a mix of confusion, memory issues, and difficulty concentrating. How it harms your brain. Interferons activate immune cells in the brain, causing inflammation that impairs cognitive function. A 2021 study in neurology found that interferon users showed reduced white matter integrity and weakened brain connectivity on MRIs. Up to 45% of patients also experience depression or mood swings, which can persist long after treatment ends. Real-life impact. Patricia, 69, started interferon for hepatitis C. Within weeks, she couldn't follow TV shows or recall conversations. She described her brain as wrapped in cotton. The mental fog was so severe she couldn't function normally, and some effects lingered post-treatment. What you can do. Monitor cognition. Work with your doctor to track cognitive changes during interferon therapy. Explore neuroprotection. Ask about supplements like omega-3s or antioxidants to reduce inflammation. Seek support. Therapy or counseling can help manage mood swings and depression. 4. Non-benzodiazepine sleep aids. The sleep pills stealing your memories. Medications like zolpidem, Ambien, and Zopiclone promise restful sleep without the risks of benzodiazepines. But they target the same brain receptors, causing anterograde amnesia, the inability to form new memories after taking the pill. How it harms your brain. These drugs disrupt GABA receptors, impairing memory consolidation during sleep. Long-term studies, like One in Sleep, 2020, show a 20 to 50% increased dementia risk with prolonged use. They also shorten deep sleep, critical for memory and brain detoxification. Many users report performing complex tasks, like cooking or driving, without recalling them. Real-life impact. Linda, 66, took zolpidem for insomnia. One morning, she found her kitchen in chaos, with no memory of cooking a meal in the middle of the night. Security footage confirmed she'd acted unconsciously, a terrifying side effect of her medication. What you can do. Try non-drug solutions. Cognitive behavioral therapy for insomnia, CBTI, meditation, or sleep hygiene improvements can reduce reliance on pills. Limit use. Use these drugs sparingly and only under medical supervision. Monitor behavior. If you notice unusual nighttime activities, consult your doctor immediately. 5. Calcium channel blockers. Heart allies slowing your brain. Calcium channel blockers like amlodipine treat high blood pressure and heart disease, but they can impair brain function by reducing calcium availability, essential for neurotransmitter release and nerve signaling. How it harms your brain. By blocking calcium channels, these drugs slow brain electrical activity, leading to mental sluggishness or brain fog. Overly aggressive blood pressure lowering can also reduce cerebral blood flow, starving the brain of oxygen. A 2022 study in hypertension linked these medications to increased dementia risk, especially when combined with other blood pressure drugs. Real-life impact. Edward, 75, controlled his blood pressure perfectly with amlodipine but struggled to find words and perform simple calculations. Switching to alternative medications preserved his heart health without cognitive side effects. What you can do. Balance blood pressure. Work with your doctor to maintain healthy blood pressure without overlowering it. Explore alternatives. Ask about other classes of blood pressure medications with less cognitive impact. Stay active. Regular exercise supports brain blood flow and cognitive health. 6. Fluoroquinolone antibiotics. The antibiotics attacking your nerves. Fluoroquinolones like ciprofloxacin are reserved for serious infections, but they carry a black box warning for permanent nerve damage, including cognitive impairment. How it harms your brain. These antibiotics cross the blood-brain barrier, disrupting GABA receptors and damaging mitochondria, the energy producers in brain cells. A 2018 neurology study linked short-term use to anxiety, insomnia, and memory issues, with some effects lasting years. Fluoroquinolone-associated disability, FQAD, affects thousands, causing lasting cognitive harm. Real-life impact. William, 73, took ciprofloxacin for a urinary tract infection. Days later, he suffered severe anxiety, sleeplessness, and confusion. Months after, his memory and focus remained impaired, a confirmed case of FQAD. What you can do. Question necessity. Ask your doctor if milder antibiotics can treat your infection. Watch for symptoms. Report neurological changes like anxiety or confusion immediately. Support recovery. Antioxidants and mitochondrial supporting supplements may aid recovery, but consult your doctor first. 7. Urinary incontinence medications. Bladder helpers harming your brain. Drugs like oxybutynin control overactive bladders but block acetylcholine, the neurotransmitter critical for memory and learning, creating a high anticholinergic burden. How it harms your brain. These medications disrupt brain communication, reducing white matter and shrinking memory areas. A 2019 JAMA neurology study found brain scans of users resembled those of Alzheimer's patients. Poor sleep, often worsened by these drugs, accelerates cognitive decline by impairing memory consolidation. Real-life impact. Janet, 68, used oxybutynin to manage bladder issues. While it helped physically, she soon forgot appointments and felt mentally foggy, forcing her to choose between bladder control and mental clarity. What you can do. Explore non-drug options. Pelvic floor exercises, dietary changes, or bladder training can reduce symptoms without cognitive risks. Minimize use. Use the lowest effective dose for the shortest time. Consult specialists. A urologist can suggest alternatives with less brain impact. 8. H2 blockers. Stomach protectors damaging your mind. H2 blockers like famotidine reduce stomach acid, but can cause vitamin B12 deficiency, mimicking dementia symptoms and increasing cognitive decline risk. How it harms your brain. By altering stomach acidity, H2 blockers prevent B12 absorption, critical for myelin production. A 2017 American Journal of Gastroenterology study linked long-term use to a 44% higher dementia risk. Symptoms like forgetfulness and depression often go misdiagnosed as aging. Real-life impact. Frank, 70, took famotidine daily for acid reflux. Over time, he became forgetful and depressed. Tests revealed a B12 deficiency, and after injections, his cognition improved, but recovery took months. What you can do: check B12 levels. Regular blood tests can catch deficiencies early. Supplement B12. Injections or high-dose oral supplements can restore levels. Limit use. Use H2 blockers short-term and explore lifestyle changes for acid reflux. 9. Corticosteroids. Inflammation relief causing brain chaos. Corticosteroids like prednisone treat asthma and arthritis but flood the body with synthetic cortisol, shrinking the hippocampus and causing emotional instability. How it harms your brain. Long-term use reduces hippocampus volume by up to 14%, per a 2020 brain study, impairing memory. High cortisol levels also trigger anxiety, depression, and mood swings, creating a cycle of cognitive and emotional decline. Real-life impact. Dorothy, 72, took prednisone for arthritis. 6 months later, she couldn't recall her grandchildren's names or recognize familiar places. Brain scans showed hippocampal shrinkage, and while reducing the drug helped, some damage was permanent. What you can do: use lowest dose. Work with your doctor to find the minimal effective dose. Explore alternatives. Non-steroidal treatments or physical therapy may reduce reliance on corticosteroids. Manage stress. Mindfulness and relaxation techniques can mitigate cortisol's emotional effects. 10. Tricyclic antidepressants. Mood lifters weakening your mind. Tricyclic antidepressants like amitriptyline were once revolutionary but can cloud cognition in seniors by blocking acetylcholine. How it harms your brain. These drugs disrupt memory formation, reducing cognitive function by 20 to 30%, per a 2018 Journal of Clinical Psychiatry study. Users often describe living in a mental fog, struggling with daily tasks. Real-life impact. Helen, 70, took amitriptyline for chronic pain. Within weeks, she forgot daily conversations and left the stove on, raising dementia fears. Her symptoms stemmed from the drug's sedative effects. What you can do: switch medications. Newer antidepressants like SSRIs may have fewer cognitive side effects. Monitor cognition. Track memory changes and discuss them with your doctor. Address pain differently. Physical therapy or acupuncture can reduce pain without cognitive risks. 11. Statins. Heart protectors harming your brain. Statins like simvastatin lower cholesterol but can starve the brain, which is 25% cholesterol, leading to cognitive impairment. How it harms your brain. Statins reduce cholesterol production, depriving brain cells of a vital building block. They also lower CoQ10, essential for brain energy. A 2019 FDA report noted 15% of users experience memory issues or confusion, often described as thinking through cotton. Real-life impact. Robert, 65, an engineer, lost his ability to balance his checkbook after starting simvastatin. His doctor dismissed it as aging, but Robert knew better. Switching statins helped, but recovery was slow. What you can do: supplement CoQ10. Ask your doctor about CoQ10 supplements to support brain energy. Monitor cholesterol. Ensure statins don't lower cholesterol excessively. Explore alternatives. Diet and exercise can sometimes reduce cholesterol without drugs. 12. Anticholinergics. Blocking your brain's communication. Anticholinergics like Benadryl and Dramamine are common for allergies and nausea but block acetylcholine, doubling Alzheimer's risk with daily use over 3 years, per a 2015 JAMA Internal Medicine study. How it harms your brain. These drugs disrupt brain communication, causing structural changes resembling Alzheimer's. They're often over-the-counter, making their risks insidious as users don't suspect the little pink pill. Real-life impact. Margaret, 71, took Benadryl nightly for sleep. She began forgetting appointments, faces, and her way home. Stopping the drug restored some memory, but not all. What you can do: avoid long-term use. Use antihistamines sparingly and seek non-anticholinergic alternatives. Check labels. Many OTC drugs have anticholinergic effects. Read carefully. Support brain health. A diet rich in choline, eggs, fish, can support acetylcholine levels. 13. Benzodiazepines, the memory eraser in your medicine cabinet. Benzodiazepines like lorazepam and diazepam treat anxiety and insomnia but block memory formation by enhancing GABA, increasing dementia risk by 50% with use over 3 months, per a 2014 BMJ study. How it harms your brain. These drugs dim the brain's recording studio, preventing new neural pathways. Long-term use can cause dependency, with some users never fully recovering pre-drug memory function. Real-life impact. Sarah, a 67-year-old teacher, took lorazepam after her husband's death. Within 6 months, she couldn't recall her students' names, despite teaching them for years. Her children feared Alzheimer's, but the culprit was her medication. What you can do: short-term use only. Limit benzodiazepines to weeks, not months. Explore therapy. CBT or mindfulness can manage anxiety without drugs. Taper safely. Never stop abruptly. Work with your doctor to reduce doses gradually. Your memories are the threads of your life's tapestry. Every moment, every loved one, every triumph. The medications we've discussed can fray those threads, but you have the power to protect your mind. Work closely with your doctor to review your prescriptions, explore alternatives, and monitor your cognitive health. Simple steps like annual B12 tests, lifestyle changes, or non-drug therapies can make a world of difference. Have you or a loved one experienced memory lapses tied to medications? Drop a 1 in the comments if this video hit home, or a 0 if it didn't, and let us know where you're watching from. Your voice matters. Don't let these silent thieves steal your clarity. Hit that subscribe button, turn on notifications, and join Ageless Living for weekly tips to stay sharp, healthy, and independent. Share this video with someone who needs to hear it. Together, we can safeguard our minds for years to come. See you in the next video.